Okay, so when I think about resilience, I think that like most things to do with people, it's really contextual, and it's very much a relationship between personal experiences and workplace experiences, and also connecting in with experiences that people might have within the kind of socio-cultural aspects of their profession. So very much a relationship. And when I think about that relationship and the relationships within resilience, it also makes me think about the relationships between staff experience and patient experience. And that's really what I'm bringing to today and this work, is that sense that as a system, we really need to focus much more at the interface between staff experience and patient experience and really understand that. And with that in mind, we know that shifting from asking patients, what's the matter with you, to asking them what matters to you, makes a huge difference to their experiences of care. And what difference we could make for everybody's experiences of care, patients, staff, carers, if we asked everybody what matters to you, what matters most to you. My sense is that if we systematically asked everyone involved in experiences of care, including staff, what mattered to them, we'd really begin to understand what mattered to them in terms of resilience, what's affecting their resilience, what's challenging their resilience, what's helping their resilience.
And I thought, my work has mostly been in stories and storytelling, listening to people tell stories, so I thought perhaps the most useful contribution I could make would be to share a couple of stories. So one is, the more I think about resilience, the more I'm reminded of a Vietnamese acupuncturist that I used to see on a regular basis, and she worked really, really hard, and she had endured lots of challenges coming from Vietnam. And what she said was, if you think about the human heart, it can only carry on doing its work because it relaxes in between every contraction. And she said, so I try to do that too. And in between each of my patients, I actually take a few minutes to walk around the garden. And so I can work really hard, long hours and long days, and continue to do that work for a long time. So I think that's kind of a useful story to bear in mind in terms of the health sector. And the second story, on my way here today, I just bumped into an old friend who happens to be a retired GP, and I told him what I was doing. Oh, he said, resilience is so important. In my day, we didn't really talk about it at all, but he said, I think resilience is how you become expert. And I kind of questioned him and said, that's an interesting proposition. I haven't heard that before. And he said, yes, you need resilience in order to learn from your mistakes and sometimes keep on making mistakes and bounce back and learn to do things better. And so that's how you become expert.
Great, thank you. And the second question is, what do you think we could do about improving resilience in the workplace?
Certainly, taking a step towards improving resilience, I think, is really important to try and find practical ways of doing that. And the NHS England work programme that's focused on improving staff experience in order to drive improvements in patient experience has really tried to connect with what matters most for staff, and really recognises that both staff and patients deserve care, compassion and respect, very much building on the work of Michael West. And one step in that direction of offering care, compassion and respect to everybody was to create the set of staff digital stories. So to invite staff to come to workshops, fully funded workshops, for them to create their own digital story and capture for them their experience of working in the NHS and capture for them what mattered most to them, and to help them really connect with what was important to them. That's really helping us understand, I guess, what I might call the root cause of resilience. What is it that's enabling people to be resilient and supporting and nurturing resilience, and what is it that's challenging resilience? And going back to the very beginning, when I said this is a really kind of contextual thing, It's really understanding how resilience and compassion and experience are all very much at the interface of the personal and professional self, and really sharing those stories. And by sharing those stories, changing conversations, changing thinking, changing behaviour, and really trying to focus on improving experiences of care for everyone, patients, carers and staff, in a much more integrated and joined up way, because we're all people, and our resilience ultimately is bound up in being human.
So I would support that in saying that we've been hearing stories from staff for the last 14 years, and what people tell us is that the opportunity to come and spend 2 or 3 days creating a reflective story is a really unusual and very much needed opportunity to reflect and step back and almost kind of retreat and think about why they came into healthcare in the first place often. So many people, including teams, have said it's really enabled us to feel more resilient, to work better, both as individuals and as teams. So I think in terms of what we could do, we could actually offer people opportunities to step back from the workplace and take a bit of time to reflect and share stories with one another.